We're on the tail.
Okay, it's 6 o'clock. We'll call the Waushara County Board of Supervisors regular monthly meeting to order. Start off with roll call.
And I'm Bill. As we reported last week, the Center for COVID Control was fined more than 20.
The TV okay, Pat, or no?
I guess so. Supervisor King is online here.
Yeah.
Now, it sounds as
Okay.
investigation does not close the loop on
Okay,
every.
everybody's present? Okay. All right, very good. All rise for the silent prayer and pledge of allegiance.
For personal IP,
Is it too long?
$22,500. The Center for COVID Control has to pay Dade Township over misleading.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Michael Donkey oversaw the process.
All right, we'll move on to the approval of the agenda. And I've been asked if we could move B1 to right between 6 and 7, right after the public hearing.
Around Wisconsin, to Dane County.
So with that change, if I could get a motion to approve the agenda. Okay, by Mr. Bonfiglio, second by Mr. Bossard. All in favor?
Aye.
Opposed? Okay. Approval of the minutes of the October 18th, 2022 monthly meeting. Okay, motion by Mr. Wadle, second by Mr. Bonfiglio. Is there any discussion? Hearing none. All in favor? Opposed? All right, and we'll move into the 2023 budget public hearing. Is there anyone that would like to comment on the budget?
Our state.
Okay.
Because, we still have the information, so I think in the future.
So with that, we'll close the budget public hearing. And then we'll move into B1. Consideration possible action on the following resolution. Resolution number 42-11-22. Resolution approving the Waushara County 2023 budget appropriation. Is there a motion? Motion by Mr. Bonfiglio, second by Mr. Peterson. Is there any discussion?
They would have been referred to the Department of Health Services. We have to be.
Okay, no discussion. We'll proceed to vote then.
Say there's no.
Okay, yes, for Supervisor Bonfiglio. Supervisor Cap? Yes or no?
Yes.
Okay, and Supervisor King?
Yes.
Okay, the motion passes. All right, we'll go into, there was no public comments. Nobody had signed up for public comments. Unfinished business, there's none. New business, the county administrator's monthly report. We're going to skip that this month since she had just given us a report 2 weeks ago. And we'll move right on to the Veteran Service Office Annual Report with the county Veteran Service Officer, Bill Rosenau.
Sunlight as we head in the next 30 days. Big question. What do we expect this November? Well, it looks to continue on with what we had through October, above normal temperatures as we head through.
Hey, Pat, excuse me, could you mute your microphone? Your background noise is coming through.
As we head into the second.
Thank you.
Good to see inflatable one. Good evening. I'm Bill Rosenau, the Waushara County Veteran Service Officer. There are a couple of faces here I don't know. So just real quick, my office, it's me and my assistant, Brian. We're over in the North Annex. Our job in a nutshell is to help veterans, their dependents, and survivors in Waushara County better understand the benefits their service earn and give them local access and assistance in applying for those benefits. We're county employees, not federal or state. We're outside of those regulatory agencies by design. That's so we can represent that claimant's interest without owing our allegiance to the big federal entity that owns the benefits. That being said, in front of you, you will see my 2021 annual report and the federal GDX that looks at the federal expenditures here in Waushara County for calendar year 2021. I'm not going to bore you with the numbers. You folks can read, and that's why I gave you handouts. The big takeaway for 2021, we saw about the same amount of veterans in the office, but it resulted in a lot less production. Lot less new claims, less new forms, and that means less results. The pandemic really took a bite out of pretty much everything. When we're looking at the financial windfall in our office, it's usually for stuff we did a couple of years ago. That's when it really starts to impact our budget, or at least our report. Conversely, less production means less expenditure, and we got to turn in or return a little over $20,000 back to the general fund in 2021. Some of the highlights for 2021. I talked in 2019 about the Mission Act. That was an expansion of VA healthcare into the community. Big federal agency or company got a contract to build a community care network. It's working, and it's been working enough. It's starting to reveal the flaws, the fly in the ointment. For the most part, it's when we have a problem with the new community care system, it's actually the civilian facility billing the wrong people. Couple of systemic problems. Working with some folks out in DC to try to get that fixed, but that's going to be years in the making. I talked about the caregiver support program, some major changes in the underpinning eligibility for that. A couple of years ago, I warned that we haven't heard the screaming yet. The screaming was so loud and high pitched, it was basically a dog whistle that went right past the local level, right into Congress's ears. They have now, for the last 3 years, stalled any actual implementation of changes to the caregiver support program. We had Blue Water and some new Agent Orange presumptive conditions come in. I saw a lot less action in the office than I would have predicted from those. Previous iterations of new presumptive conditions have really brought in a huge wave of new veterans and new disability claims. We did not see that with the Blue Water Navy veterans. Not sure why yet. I'm going to brag a little bit here. In 2021, I was basically, for the past 7 years, I've been involved in a course of study called Certified Veterans Advocate at the national level. And I was told by the instructor in December, she said, Bill, you will test out this year. 2 days before the course, they changed the test. It used to be an open book, 100 question, no time limit, some pretty high level legal thinking stuff. They said closed book, 50 questions, 2 hours, go. I passed, and unbeknownst to me at the time, out of the 7,600 certified or accredited veteran service officers nationwide, I joined a group of about 16 who've met this level of accreditation. I didn't realize it was that elite. It is that elite. So I'm pretty darn proud of that one. That's where we're at right now. Again, we're looking at coming in significantly under budget for 2022, primarily due to COVID, and some pretty big donations. Just this past conference, I was reelected to the state association's legislative committee. I primarily focus on federal legislation and how it's going to be affecting veterans, but I dabble in the state stuff when I have to. I'm I'm also the state County Veteran Service Officer Association's representative to the Incarcerated Veterans Program Committee, where I work with wardens primarily statewide, trying to affect how our incarcerated veterans are treated in the Department of Corrections. I mentioned before the meeting, we just saw the passage of the PACT Act. I'm going to talk about that a little bit, in a little bit more detail. It was, suffice to say, the most sweeping legislative change in the history of the Veterans Administration. It's huge. Challenges we're facing in the office, claims complexity. Our claims burden has shifted almost entirely from an injury-based disability claims process to an exposure-based disability claims process, which means we have to understand the exposure, we have to understand the medical outcomes, and we have to start tying this together, this legal theory and medical theory together in a much more complex manner. That, and in the good old days, a veteran would basically come in, we'd tell a story, send it up to the VA, and they'd have to figure it out. Now we have to build all of the evidence to support that claim right up front. So the actual formation of a claim is much more complex than it used to be. By front loading the claims, the VA got much faster. Unfortunately, and then they're much faster. Unfortunately, they're just making stupid decisions much faster. I'm touching the same claim now that I used to wait for a year and a half to go through, and they'd probably come up with the right decision in a year and a half. Now in that year and a half, I'm touching that same claim probably 5 or 6 times before they get it right. They really have sacrificed quality for quantity. The PACT Act, I told you I'd get there. Here's a mouthful. The Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxins Act, the PACT Act. Like I said, the most sweeping change ever in VA law. And we haven't even heard the first susurration of a ripple on the shores yet. It's going to be a tidal wave. It affected basically 15 different chunks of law. Expanding who's eligible for VA healthcare. If you're familiar with Agent Orange, it expanded locations that are assumed exposed. It added a whole bunch of new, what are called presumptive conditions, assumed conditions related to Gulf War exposures. And I'll tell you, Gulf War exposures make Agent Orange look like candy. It's going to be a lot of work for a very long time. I thought I was busy now. No. Another big one we're running into is digitizing records, getting ready to move to the new building. I really don't want to bring all that paper. We're going to be working with OnQ solutions. We just can't seem to touch base. Still working on that. So where we're going, we really are projecting even more increased complexity in the claims and the process. If we can't get OnQ, then along with those claims, Brian and I are going to have to figure out a way to start scanning. We do have a declining veterans population. Let's face it, they're dying and we're making less veterans. When I was born, 1965, over half of the adult population in the United States had served in the military. We're less than 10% now, and currently serving less than 1%. It used to be they'd pick you up, they'd send you to war, and you were done. We're using the same crop of veterans over and over and over, and we're just on the tail end of 30 years of war. So think about what that's doing as far as these exposures, mental health, etc. Multiple combat tours, not fun stuff. Another thing we've done, and I think the VA really didn't think this one through, or DOD didn't. when we were looking at previous eras of veterans, they were small, well-defined periods of time. That gave birth to eligibility for what's called non-service connected pension, probably the most onerous benefit managed by the VA. We just laid down the baseline for 30 years of veterans and their survivors to use that VA pension. That's gonna be a long drawn out process. New building holds promise. Some unknowns too. One of the big things it's going to do is we're going to share front office staff with Department of Aging. That's going to take some of the pressure off my assistant veteran service officer, so he can concentrate on these complex claims along with me. But it's going to be a learning curve. Having somebody else sit up front, try to translate stuff and get it back to us. That's going to be interesting. How we're getting there with the scanning. Like I said, I'm working with OnQ Solutions. I think we're going to be able to come up with a countywide solution to cover those expenses. I just mentioned the front of the house clerical support shared with Department of Aging. That's going to take a huge burden off and let us really concentrate on producing. I'm not even going to get into this. This one's huge. A couple of things, just if you want to scribble some notes, there are a couple of pieces of law sitting up at the federal level right now. HR 4601 and Senate Bill 2405. Those are called the Commitment to Veterans Support and Outreach Acts, oddly enough, the CVSO Acts. That's where, in fact, I'm going to credit Tammy Baldwin with recognizing this. When they went to the fully developed claims and put all the weight on my office, we took a lot off the federal government's shoulders. I'm actually the claims guy now. The VA is not. They just adjudicate now. Recognizing this, Senator Baldwin's office is trying to get federal funding to help cover some of the costs of my office. That would be huge. That would be huge if we get a couple more processors in at federal expense. Like I said, it's a busy time right now. I don't think we've I don't think I can even conceive how busy it's going to get with the PACT Act. As soon as I start advertising that, it's going to get nuts. But the future is bright. I think the setup with the new building, I just found out last week, we had a community member pass away, and she put together a revocable trust that my office is now a beneficiary of. She gave us 20 grand earlier this year. She just gave me another 10 grand from that. And I just found out that 10 grand is going to be recurring every year. Subject to your questions. I know I went way over time, but yeah, I like that piece too.
Bill is a reason that the claims are taking so long and they have to go through this different process. Is it because they're so expensive, or is it because there's fewer population? What's causing that to change from how it used to be? You said it used. And is there any? I mean, and you're trying to change it with.
Yeah, it's primarily, if you think about it, when you're looking at let's say a World War II veteran,
Right.
They got shot, they lost a leg. It was a physical injury. It's something that's pretty easy to say, yeah, you're missing a leg because it got blowed off.
Right.
And that adjudication process is pretty easy. But when you say we're putting in a claim because you were exposed to benzenes and volatile hydrocarbons at Camp Lejeune through the drinking water, and now you've developed lung cancer, but yeah, you did have a history of smoking, and it's the complexity of the claim itself.
Okay.
That's where I was getting at with the shifting from injury-based to exposure-based disability claims.
Okay.
Um,
So it's
that-
more just the complexity. It's not the cost.
That's a big piece of it.
Okay.
I don't think that it's the cost, because I don't see anybody going in to adjudicate a claim at the VA and saying, boy, this one's going to cost. That's that policy level stuff. That's where the laws come in. But the person sitting down, I mean, there's literally 6 weeks of what's called STAR training removed from saying, do you want fries with that? And they're looking at some pretty complex medical theory and legal theory. VA law is pretty complex stuff. So.
Yeah. Does anybody else have any questions? Okay, very good. Thank you, Bill. Doing a great job. Thank you. Okay, we'll move into the other report, the Child Support Office Annual Report with Director Kim Stebbins. Hi, Kim.
Good evening, everybody. For those that you don't know me, I'm Kim Stebbins, and I'm the Director of Child Support for the county. I've been with the county for 10 years, and I've worked in the child support world for 16 years. So I'm just going to go over first I'll go over our organizational chart. I'm the director. We have our right-hand person, Corporation Counsel Zowski, who goes to court with us whenever we need to or gives us legal advice, signs off on our documents. I have 3 child support specialists listed below. To go over our primary revenue sources, we get performance-based incentives from the federal government. We have incentive funds for meeting performance measures. So that would be paternity establishment, court order establishment, child support collection, and arrears collection. Those performance incentives are not eligible for the federal match dollars. Below, we do receive general purpose revenue. So if you recall, last month, the board had supported our resolution to ask the governor to include in his next budget a $5 million per year increase for the child support agencies across Wisconsin for the general purpose revenue. So that state allocated funding is eligible for federal match dollars. So we'll get 66% match. So that does draw down much more money, as you can see, towards our program. Other sources of revenue, medical support liability incentives, which is birth cost recovery. That's used to be eligible for federal match dollars. That's no longer eligible. That is also one of the reasons why we are asking for additional general purpose revenue, because we've lost that funding. Medical support revenue, that is the money that we get for adding private health insurance for children that are on Badger Care. So we get, they look at how many children that we have added in our system, and then we get funding for that. We do collect some fees in our office, not a lot, but we do collect some fees, so that's program income. And after all is said and done, that's when the county levy kicks in. Now that's a good looking group up there. That's my staff. That's Pam, Sue, myself, and Michelle. So in 2021, we received an Outstanding Achievement Award. Very proud of my staff. I don't take any credit for it. I lead the agency, but they are the boots on the ground and folks, and I'm indebted to them. They are a great group of girls that work really hard. So we are one of 17 counties in Wisconsin that received an Outstanding Achievement Award. It's kind of been one of my goals to achieve. So we did that, and I was really proud. Connecting to families. So how do we connect to the families? We get referrals from the Public Assistance Program. So if the child is signed up for Badger Care or Food Share, W-2, child care assistance, we get referrals over from economic support to review for an establishment of a child support order, or to make sure that a child paternity is established. So every child has a father's name listed on the birth certificate. So those are the two primary things that we do. We also get the court orders that come across through divorce actions, enter that into our system. So we will collect not just child support, but if there's a maintenance order through the court, we'll collect that through our system. We don't enforce those orders, but we will send out garnishments to employers for maintenance orders. As well, we do accept applications from folks that are not on public assistance benefits. If someone comes in and they want us to establish a child support order, or even say, hey, can you help me establish paternity for my child? Either mom or dad can come in and apply, and we will help them do that. Another thing that we do establish orders for children that are placed out of home. So you're talking foster care or kinship care, or juveniles that have been placed in the Wisconsin prison system. So we will establish orders if there's a referral from Human Services or the courts. And that funding generally goes back to the state if we're collecting the support. So just to review the services we provide to families. The services we provide reduce childhood poverty rates. We establish parental rights by being involved. We ensure that the children have access to health care and promote the involvement of both parents in their children's lives. So like I said, we do establish paternity, and by us being involved, that allows the court or the parties to agree on custody, which is decision-making or placement of their children. So it's both parents being able to be involved in their children's lives. We establish support orders. We enforce those support orders. We will help folks modify their support orders if they need to, increase or decrease based on their circumstances. When we have health insurance orders, which is a requirement, we do check with the employers to see if there is health insurance available at a reasonable cost. The employer will get back to us and say yes or no, that it's is or not. So that's an actual order of the court, and that the employer has no choice but to add if it's determined that it's at a reasonable cost. So that's helping these children get off of the Badger Care and onto private health insurance plans. We collect past due child supports, which is called arrears. We also have referrals made to employment and training programs, and then we coordinate with other social service programs. This is just a little review of, again, the health insurance that when we get involved, this is from some statistics from 2019. So almost 29,000 Badger Care eligible children were enrolled in private health insurance. That, you know, all of that being involved resulted in $26.6 million savings to the state. And then, you know, that also saves money to the federal government too. So child support positively impacts families. 68% of children in poor families in Wisconsin live with a single parent household. For poor families that receive child support, it makes up 42% of their household income. Children that receive child support are less likely to enter the criminal justice program and are more likely to graduate high school because they're receiving that financial support. They have a healthy home where they're receiving, you know, food, clothing, shelter. All that's all goes towards the child support. And they have fewer substantiated child protective services referrals. And as I stated before, the fathers who become involved by us helping get custody and placement rights, they have more involvement and positive interactions with their children. Right now, I would welcome any questions that you have for me.
Anyone have any questions for Kim? Congratulations on your award too. That's very prestigious. Any questions? Okay, thank you. Okay, with that, we'll move on to board suggestions for future agenda items. Is there any? Okay, and then we'll entertain a motion to adjourn. Mr. Bonfiglio, second by Mr. Eckstein. And we are adjourned. There it is. Yeah. Come on up.
Thanks, Pam. Thanks, Bill.
I know. It was a pretty fancy picker there. Hey, Eugene, that was a pretty fancy picker. One by today.
Oh, yeah.
Is that one you had?
He's right here.
It's like a-
Oh.
Oh, okay. I thought it looked like it was on there.
Yeah.
Yeah, it's pretty nice.
I think that's the shortest. Yeah.
For me, result in your.
Oh, yeah. Oh, do you want to stop and see what you had there?
He actually.
So, nice.